Ready? Okay. Okay, so today we are going to talk about the hypoadrenalism. In the last class we talked about the Cushing syndrome, isn't it? So today we'll be talking about the hypoadrenalism, and we'll be trying to see what happens when the in our body when the cortisol and other hormones are less, right? So today our topic is going to be hypoadrenalism. Or sometimes we also call this disease as adrenal insufficiency. A very simple topic, this one. Okay, so by the term it is very clear. Adrenal insufficiency means there is some insufficiency going on in the adrenal gland, isn't it? And keep in mind, whenever a patient of adrenal insufficiency comes to us, we must know whether this patient is having the chronic adrenal insufficiency or acute adrenal insufficiency. And why I am telling you this thing? Because if somebody is having the acute adrenal insufficiency, then this patient may go through the emergency state anytime. It's a life-threatening situation, and we must treat the patient as early as possible. So the hypoadrenalism, it could be of two categories. Either it is going to be the chronic case, or it is going to be the acute case. And as I told you, the chronic situation is the example when it is going to be a life-threatening situation, and generally when it is chronic case, then we simply call it adrenal crisis, or sometime in some book they even call it Addisonian crisis. And don't forget, this is the state which is an emergency, and the treatment should be given as soon as possible, otherwise the patient may have the life-threatening situation. So all of you tell me, hypoadrenalism, how many categories? Two categories, what are they? The chronic and the acute, isn't it? So the chronic means it is going to be the emergency case, and acute means it is going to be non-emergency case, right? So I think the parasympathetic nervous system in your body is very high right now, right? So activate your sympathetic nervous system. You had so much food with you, so don't get the situation. Keep in mind, the chronic is going to be less dangerous to our body because our body learns how to cope with the low amount of cortisol. What is problem is which one? Acute. So chronic is not the one which is going to be life-threatening. It is rather going to be the acute one. And since it is happening very acutely, that's why we are also calling it what? Adrenal crisis, or we are also calling it Addisonian crisis. Keep in mind, whenever we see the word crisis, it means generally it is going to be very rapid deterioration. Right, so it is not going to be the case of acute, but it is rather it is not going to be the case of chronic. Rather, it is going to be the case of acute situation. All of you got idea? So tell me, hypoadrenalism of how many category? What are they? Acute and chronic. Which one is the life-threatening one? Acute, and we also call it which crisis? Adrenal crisis, or we also call it Addisonian crisis. Now we must know that what things in our body can lead to the acute adrenal failure or acute adrenal crisis. So the first one, the most important one, you must not forget. We simply say that there is some hemorrhage in the adrenal gland. So anything that can cause the hemorrhage of adrenal gland can cause the acute adrenal crisis, right? And what can cause the hemorrhage of the adrenal gland? One of the very important cause you should not forget. We also call it the Waterhouse. Have you heard this name? So we call it Waterhouse-Friderichsen syndrome. So Waterhouse-Friderichsen syndrome is one of the hemorrhage of the adrenal gland. And what causes the Waterhouse-Friderichsen syndrome? One of the very important cause here is going to be the Neisseria meningitis septicemia. So all of you know that Neisseria meningitis is very notorious kind of bacteria which can cause sometimes the meningitis. We also call it meningococcal meningitis. So if the patient is having the Neisseria meningitis septicemia, then this Neisseria meningitis can also cause the bleeding in the adrenal gland, and certainly it can go through the acute situation, emergency situation, adrenal crisis or Addisonian crisis, right? So Neisseria meningitis septicemia, this is the very important cause, and we must know about this very clearly. Not only that, sometimes even the DIC can lead to the hemorrhage of the adrenal gland, and sometimes even the endotoxins can also lead to the adrenal gland hemorrhage, and all these things are going to cause the adrenal crisis. And again I am telling you, if the patient got the adrenal crisis or Addisonian crisis, is it emergency condition or not? It is a life-threatening situation and the patient can die anytime, so we must begin our treatment as early as possible. In fact, if somebody comes to us with the adrenal crisis, we don't even bother to confirm our diagnosis. If your suspicion is having the very good favorable situation, then we begin the treatment without depending upon the confirmatory diagnosis, right? So this is the first cause, that is the hemorrhage of the adrenal gland. Okay, now very quickly let's go for the second cause of the Addisonian crisis, and the second cause that can sometimes lead to the situation is going to be the something called as necrotizing adrenalitis, right? So all of you write this name down and I will try to explain. Necrotizing adrenalitis. And by the name you can see that in this patient the adrenal gland have gone through the necrosis, and that's why suddenly the cortisol and other adrenal hormones have been decreased and the patient have developed a very severe situation. So this is going to be the necrotizing adrenalitis. There are few things you must not forget, that this necrotizing adrenalitis is caused by the virus. Which virus? CMV, full form? Cytomegalovirus. And never forget that this CMV generally is going to cause a necrotizing adrenalitis in the patient of HIV. So when the HIV patient, they get the CMV infection, they can develop the necrotizing adrenalitis. So the data says almost 10% of the HIV patient, they develop the CMV infection and they develop the necrotizing adrenalitis. Almost 10% of the whole HIV patient, right? So this is the another very common cause of the adrenal crisis. What is the first and very important cause of the adrenal crisis? The Waterhouse-Friderichsen syndrome. What is the second one? Necrotizing adrenalitis. In the same way, sometimes the patient can develop the Addison crisis if a patient is taking high dose of the steroid for a long time and he suddenly stops it, right? So don't forget the abrupt, without tapering down the steroid, the patient stopped it abruptly. So abruptly stopping steroid which was being given in high dose for a very long time, right? So this patient can again develop the adrenal crisis, or he can develop the Addisonian crisis. So these are the common, very very common three causes of the adrenal crisis, the Addisonian crisis. There are few more that you should not forget. One of them is that if patient is having very very severe hypertension. So severe hypotension sometimes can even lead to the Addisonian crisis. And not only that, sometimes, especially it happens in the accident cases, if there is some severe trauma which has involved the adrenal gland, can also lead to the Addisonian crisis. So I have given you at least 5 causes of the adrenal crisis, and you should be very careful about them, because don't forget, Addisonian crisis is going to be the life-threatening situation, and the treatment, if you don't begin on time, the patient may even die, right? So what are the 5 causes of the adrenal crisis? Tell me the first one, what I told you. Waterhouse-Friderichsen syndrome, and it is due to the hemorrhage of the adrenal gland. And which septicemia is involved here? The Neisseria meningitis septicemia, right? And what is the second cause of the adrenal crisis? What is the second one? The patient can have the hemorrhage, the patient can have the necrotizing adrenalitis, and I told you, necrotizing adrenalitis is caused by which virus? Cytomegalovirus, and we find this infection in almost 10% of the HIV patient. And the third very important thing I told you, that patient is taking high dose of steroid for a very long time and he abruptly stops it, then again the patient can develop the Addisonian crisis. And the fourth thing I told you, that the patient is having the severe hypotension, or patient is having some abdominal trauma, severe trauma which is causing the damage of the adrenal gland, then again the patient can develop the Addisonian crisis. And again I am repeating that if somebody came to you and his features suggest it is very high suspicion that the patient is having the adrenal crisis, then we don't even bother to confirm our diagnosis. We begin our treatment instantly, because the life-threatening situation, and the confirmatory diagnosis takes some time. So we don't have much time with us. So we need to begin the treatment as soon as possible. But now let's go for the another form of the hypoadrenalism. And what is another form of the hypoadrenalism? The chronic form, right? So the acute form was there. Now we go for the chronic form. And the chronic form of the hypoadrenalism could be again of 3 categories. If there is less amount of cortisol production, less amount of the adrenal gland hormone production because of some problem in the adrenal gland itself, then we call it primary hypoadrenalism, right? So if it is the adrenal pathology, we call it primary hypoadrenalism. Sometimes your pituitary gland will not produce the ACTH, and that's why the patient may have no ability to produce the cortisol or the adrenal cortisol, and that's why we say that it is secondary hypoadrenalism, right? And then the third one is when the hypothalamus is not able to produce the CRH. What is the full form of CRH? Corticotropic releasing hormone. Then again patient can develop the hypoadrenalism. So don't forget, all together we have got three categories here. The number one category in the chronic hypoadrenalism is going to be simply the primary, we call it primary hypoadrenalism. Primary hypoadrenalism. It simply means that the patient is having the problem in the adrenal gland. And there are some examples, we will discuss about them. And then the second one you must not forget is the problem in the pituitary gland. And if the patient got the problem in the pituitary gland and the pituitary gland is not producing ACTH, and then patient is having the hypoadrenalism, then we simply say that it is the secondary hypoadrenalism. And of course the third one we learned that when the patient is having some problem in the hypothalamus and then he is not having the ability to secrete the ACTH because there is no CRH, and then he is not secreting the cortisol, then we say that he is having the tertiary hypoadrenalism. So I want all of you to make one table and we try to understand them very clearly, right? So I want all of you to make the table, and the table goes something like this. We have got the three different category of the chronic adrenal insufficiency, and in these three category we will try to see that what things can cause the primary, what pathology of the adrenal gland can cause this situation. Then we will see that what things in the secondary are there and the tertiary. And then there are a few things that we will be seeing. Number one, all of us we need to see that what is the value of cortisol. Cortisol is increasing or decreasing. Then we will try to see that what is the value of ACTH. Right, what is the value of ACTH? And the third thing we will try to see that what is the value of CRH in this case, right? Or let's not think about the corticotropic releasing hormone, we can neglect that, but rather we need to see a few more things here. Number one is there going to be hyperpigmentation or not? And last class when I was teaching you about the Cushing syndrome, over there also I gave you some idea about the hyperpigmentation, so same concept is going to be used even here. So we'll try to see that. And then the very important one we need to understand that what will happen to the sodium and what will happen to the potassium. So these differences are going to help you to understand in the future when the patient comes to you with the chronic hypoadrenalism, whether they are having which feature, right? So all of you tell me, how many categories are there in the hypoadrenalism? Two categories. What are they? Acute and the chronic. Acute means it is the crisis and it is a life-threatening situation, so treatment should be started before we do the confirmation of the diagnosis. And the chronic means it's going for a long time, and again we divided them into three categories. What are they? Primary, secondary and tertiary. And we just now learned, in case of primary means the problem is the adrenal gland. And there are two things you should not forget. The number one is if the adrenal gland is being destroyed due to the autoimmunity, right? If the patient develops the autoimmune adrenalitis, if the patient is having some antibody produced against the adrenal gland, right, then they are going to have one disease, and this disease we call it Addison's disease. So you should never be confused. Never be confused that Addison disease is equal to hypoadrenalism or adrenal insufficiency. Never be confused. Addison disease is just one of the type of adrenal insufficiency, right? And just now I told you what is Addison disease. Addison disease is due to the autoantibody. Your body is going to produce some antibodies against your own adrenal gland, and then this antibody is going to destroy the adrenal gland and causing the autoimmune adrenalitis, right? And this disease also have been given name, what we call it? Addison disease. So don't forget, if somebody asks you what is the antibody which causes the Addison disease, your answer is going to be the antibody that is going to cause Addison disease is going to be antibody against one very important enzyme of your adrenal gland. We call it 21 hydroxylase enzyme. You know that your in your adrenal gland, in order to synthesize the steroids, we have different enzyme system. So one of those very important enzymes is the 21 hydroxylase enzyme. So in the Addison disease we have found majority of the people are going to develop the autoantibody against what? 21 hydroxylase enzyme, and this antibody will be destroying this enzyme, and along with this process they are also going to destroy the adrenal gland. and the patient will develop the autoimmune adrenalitis, and this disease we call it Addison disease. Clear what I'm saying? And then there are the second one that I would like to talk about. Many things can cause the primary hypertension, but there are two things I always focus about. The second thing is the tuberculosis. The TB infection in the adrenal gland used to be very common, and still it is very common in the developing countries like our country, right? And again, this can also cause the adrenalitis, infectious adrenalitis, and can cause the adrenal insufficiency. I'm telling you one thing, if you appear in the exam and if they ask you which is the most common cause of adrenal insufficiency, then your answer should be autoimmune adrenalitis, your answer should be Addison disease. In the USMLE, the data they give that 80% of the 80% of the adrenal insufficiency is going to be by the Addison disease. But this data may not be true for the developing countries. In developing countries, which is the most common cause of the adrenal insufficiency? Tuberculosis. So in our country, we are going to have more chance of adrenal insufficiency by the tuberculosis more than the Addison's disease. Also got idea? So remember this thing, that Addison disease is going to be the most common one if you are appearing in the USMLE or the FLAB or the Australian exam. But if you are working in your country and then you want to know that this patient got adrenal insufficiency, what could be the most common cause, then you are going to think about what? Tuberculosis. There are so many different causes of the primary adrenal insufficiency, but I am not going to discuss all of them. I just want you people to know two things, Addison disease and which one? Tuberculosis. And you already know, in case of the secondary hypoadrenalism, where is the problem? Problem is in the pituitary gland, pituitary disease. And in the tertiary hypoadrenalism, there is the problem in the hypothalamus, and most of the time we find that this hypothalamus will not be able to release the CRH if the patient is taking the steroid for a long time and he abruptly stops it. And producing the CRH requires some time. So we find that tertiary hypoadrenalism mainly happens in those people who abruptly stop the steroid, and they are lucky enough not to get the acute hypoadrenalism. Right, they are lucky enough to not get the acute hypoadrenalism, and they got the tertiary hypoadrenalism. Again, I am repeating. Once somebody stops the abruptly the corticosteroid, the steroid, then why they get the hypoadrenalism? Because the hypothalamus will not be synthesizing the CRH that quickly. It requires some time to produce the CRH, and you can imagine, if the corticotropic releasing hormone is not being produced on time, then no ACTH and no cortisol, and then the patient is going to suddenly get the adrenal insufficiency. Right, so these are the three things, and now along with that I would like to talk about some more thing here. All of you focus here. Last class I have already discussed that we have got this our hypothalamus, and our hypothalamus, they keep on producing one hormone. What is that? CRH, and this CRH will activate the pituitary, and pituitary will be doing the job. What is that? It will be producing ACTH. But never forget, whenever the pituitary is stimulated to produce the ACTH, before the ACTH we have got one precursor. And this chemical, what we have given the name? Pro-opiomelanocortin. Right, so don't forget that whenever the CRH will stimulate the pituitary, they first produce one chemical, we call it POMC. Once again, give me the full form. Pro-opiomelanocortin. And this POMC is the one to give rise to the ACTH. In fact, not only ACTH, this POMC also forms another very important hormone from your pituitary gland. What is that? The melanocyte stimulating hormone. So we already know this thing, that whenever in your body there will be more ACTH, it means there is more POMC, it means there is more MSH. And not only that, in fact, even the endorphin in our body is coming from this precursor POMC. So even the endorphin will be very high in these people. Right, but right now we are not focused about the endorphin. I want to talk about the hyperpigmentation, that's why I am talking about the MSH. And then you already know that in case of it will go to your adrenal gland, and all of you tell me, what is the shape of your right adrenal gland? Right adrenal gland is which shape? Triangular. And what is the shape of your